Evercare is looking to provide affordable and quality private healthcare, and we're specifically focusing on the emerging markets. We have got now a presence in India, we've got a presence in Bangladesh, in Pakistan, and of course here in Africa, we've got a presence in Kenya as well as in Nigeria. Our focus is to build an integrated a healthcare platform, for affordable healthcare.
Would you talk to us about the priorities as of now with regards to COVID-19? How do you prioritize the work on the ground?
Of course, the priorities, they literally come, with the waves, and we have to adapt and we have to change as we go. We no longer have the luxury of setting, 5-year strategies. Priorities change. So when we were in the middle of a wave, end of March, as well as April here in Kenya, and we had to, of course, attend to that. So our ICUs were full with the COVID patients, and we attended to that. And we've been now out of the wave, or at least the peak of the wave, for a few weeks now. So we're turning our work again to the important work of making sure that people who need elective surgical procedures can be able to access those.
Most people agree that the coronavirus crisis has shed a light on the need for more investment in health systems. Now, talk to us about the role that the private sector can play, and why is private sector involvement critical?
So I think it is a well-established fact that public health investments, on the continent of Africa, they lag behind. If you look at the percentage of GDPs that countries on the continent spend, if you look at the percentage of healthcare, percentage of total government expenditure, in many respects, those lag behind. And unfortunately, they've lagged behind for many, many years. So we kind of coming out of decades of underinvestment in healthcare by governments on the continent, and that's the case in most countries on the continent. And of course, what that means is that private sector investment then becomes very critical in order to supplement. We are in Kenya that we work hand in hand with government. Government, they've got a national health insurance fund, which is a public fund, but they contract also with private providers in order to be able to access, a healthcare within the private sector. So I think it's really critical, that the continent moves in the direction of leveraging all the expertise, all the resources that are available on the continent, so that the communities can benefit. And that's really why our work that we do at Evercare is very critical, because really it's about going where other private investors would not normally go because of lower returns, but really going there because we know that healthcare is a fundamental right, and we've got to make sure we find ways of delivering that in an affordable way and in a safe way.
What sorts of lessons do you think we can learn from this, from your perspective, and what new solutions post-pandemic to develop health services can be put in place? Probably
the biggest lesson out of the pandemic is that if one of us is affected, if one city, one country, if one continent is affected, as an entire global community, we should be concerned. We should not be in any state of complacency, thinking that because we have got healthcare infrastructure sorted in our little corners, that we will be fine. I think we've got to join more hands and make sure that we are all investing in healthcare infrastructure, in the most remote areas of the world, so that when, God forbid, when the next, pandemic comes, that it will find us in a much stronger state as the global community.
To your opinion, what will recovery from COVID-19 in Africa look like?
What it should look like is that I think we need to really open up different ways of meeting the need. Of course, there are many people who are establishing, big, hospitals that are targeted at acute and tertiary care. But I think what we fundamentally need is to be able to find ways of bringing private healthcare very close to where the communities are. How do we deliver, private healthcare in the rural communities of the continent in a manner that is safe, in a manner that is affordable? How do we make sure that, we move away from resources being, concentrated around the cities, that, highly skilled people are able to also, reach the remote areas of the continent? And really, it's about how do we merge, both the physical, infrastructure that we have. How do we match that with the human capital? How do we match that with technology, in order to be able to advance those important goals?
Dr. Dumanikula, it was great to speak with you. Thank you so much for your time.
Thanks,